Good morning. This is Marian Mulkey at the California Healthcare Foundation, and we're going to get this webinar on online user experience at coveredca.com underway very shortly. We appreciate the participation of a number of speakers today, and we appreciate the large attendance that we've had. We've got some 500 people signed up to be with us today. My name is Marian Mulkey. I'm the Director of the Health Reform and Public Programs Initiative at the California Healthcare Foundation. We do have a very large audience today. We are recording the session and lines are muted for all participants. Presentation slides and video clips are going to be available at the Foundation's website, chcf.org, later today. Because much of the presentation relies on slides and video, it's important that everybody be at a computer screen with speakers on and volume up. Audio alone through your phone is not going to give you a good experience for this event today. So to set a little bit of context, the Federal Affordable Care Act offers an extraordinary opportunity to get more people covered in a simpler, more streamlined way, particularly in a state like California that's expanded its Medicaid program, Medi-Cal in our state. Covered California is a central hub in realizing that potential. The California Healthcare Foundation funded the analysis we'll be hearing about today as one of several projects to better understand consumers' earlier experience and help inform continuous improvement of ACA implementation in California. In related projects, CHCF recently released a broader analysis of consumer enrollment experiences through Covered CA and has work underway to look at experiences using healthcare under new Covered California plans. To understand consumers' online experience at coveredca.com, we engaged Goto Media, a research and design firm based in San Francisco, to observe consumers moving through the shopping and enrollment process. Also involved in the project was Manat Health Solutions. Manat has deep expertise in federal and state policy, and for the purposes of this project, their understanding of the Affordable Care Act's eligibility and enrollment requirements and policy goals was particularly germane. Throughout the presentation that you're about to see, you'll see small gold policy icons that indicate observations offered by the Manat team. As the research was conducted and upon completion, CHCF shared interim results with Covered California staff and the Department of Healthcare Services. We are delighted to have two state speakers with us on the call today to offer their perspectives. So the agenda for today's webinar is as follows. Allison Meyer of Goto Media will spend about 25 minutes presenting findings. Deborah Backrack of Manat Health Solutions will offer a brief policy perspective. Chien Lam of Covered California and Anastasia Dodson of the Department of Healthcare Services, which administers Medi-Cal, will offer reactions. And then we hope to have 10 to 15 minutes for questions and answers at the end of the session. If you have questions, please submit via WebEx chat. We won't be able to respond to everyone in our 1-hour call, but we'll do our best to address major themes. So with that, Allison Meyer, please make our presentation.
Wonderful. Thanks for getting us started, Marian. My name is Allison Meyer from Goto Media, and I'm going to walk you through the research findings from this project. This project explored the website portion of Covered California, and we were looking to uncover insights into the online experience of signing up for health insurance. To do this, we did a combination of remote usability testing, in-person usability testing, and follow-up calls. The usability testing is a one-on-one conversation between the researcher and the participant, where we observe their screen and see how they're using the site. The in-person usability testing took place at participants' homes. The follow-up calls were a couple of weeks after the initial sessions, where we called participants, found out what happened since our initial research session. Some changes were made to the Covered California website after we did this testing, and so when it has changed, we note that in the report. This report highlights the examples of some findings from this project, and it's not a comprehensive list. There is a lot of information in this report, and I'll be going through it somewhat quickly, but as Marian said, it'll be posted online after the webinar. So here's just a quick look at some of the faces of the people who participated in this study. We were looking for people with a diversity of background and experience because we wanted to see a variety of interactions with the site. So this is a kind of dense slide, so I'm not going to spend a lot of time on it, but essentially we had a list of desired participants and hypotheses about what participants we were looking for, and then the final participants and how they met that. This just shows you a quick breakdown of who we ended up talking to. We spoke to people from a range of ethnicities, Also a range of ages. We focused on people in their 20s and 30s, but also spoke to people in their 40s and 50s. And we looked for people who we thought would qualify for a variety of eligibility on the site. So either no subsidies or premium assistance, which is tax credits based on income and family or household size, as well as Medi-Cal qualified. So in terms of the general impressions and outcomes, we found that participants typically reacted really positively to the homepage. They described it as welcoming and really were relieved that it wasn't intimidating. As they proceeded to use the site, however, we saw these positive impressions diminish. Sometimes they struggled to use the site or even formed incorrect understandings about their options and their eligibility. All of the participants went into these sessions interested in coverage, but only one person enrolled in health insurance during the session, and no others had enrolled in the follow-up 2 to 3 weeks later. Some of the reasons why they didn't enroll included that they were just unconvinced that Covered California was right for them. The process didn't facilitate enrollment in Medi-Cal. They received conflicting eligibility messages, and we'll have additional slides that explain more about that, or they just wanted more information. They didn't feel like they had the right information at that time to make a commitment. So the website includes various sections, and participants explored them generally on their own, but with some guidance from researchers when they were stuck. Exploration wasn't typically a linear process prior to starting kind of the account creation and application flow, but the various components were just exploring the site, whether the homepage or the various help areas, shop and compare, where they could enter some information and get a preview of plans that were like ones that they would be offered later, creating accounts, and then submitting their data and their documents, viewing plans that they were eligible for, and then enrolling. So we've got various average times for how long people spent on these, but these may have been altered due to the presence of the researchers and the research project. So out of the research, we developed 6 key themes. So there were a lot of findings, and we really grouped these into 6 main categories, and these are the things that we'll focus on for the rest of the presentation. So the first one is understanding the meaning of questions and definitions. The second is comprehending eligibility and next steps. The third is entering simple data. The fourth is understanding steps and sequence. The fifth is finding information and answers. And the sixth is comparing and choosing plans. So the first one that we're going to look at is understanding the meaning of questions and definitions. Participants frequently did not understand what was being asked and were therefore unsure how to answer. The results of this were guessing, skipping, or using Google to find answers. And the reactions were frustration and feeling inadequate. So one example of this was household information. Particularly those who lived with roommates did not know how to answer the number of people in the household question. There was no tooltip for this field in Shop and Compare or in the application. Preview Plans does have this tooltip, but it didn't answer the roommate question. You can see it here on the bottom right. It just says enter the number of household members, including you. Again, participants were also unsure how to answer this question if some of the members of the household needed different coverage or if they wanted different coverage for different members. There is a policy note here, and I'll let Deborah Backrack address this at the end of the presentation. So you see Susan here. She's saying, if I live with roommates, does that think that these are my family members? The head of the household. I guess I'm the oldest, but it's tricky because we're not really a family. Naturalized citizen was also a question that confused many. About half spent time really debating how to respond to this and frequently selected yes before selecting no. So you see Jarek's quote. He says, yeah, of course, and he clicks yes. And then, wait, I thought naturalized means you're naturally a citizen by birth. Wait a minute, so I think that naturalized actually means the opposite. Income was another place where participants struggled. Throughout the application, users are asked to have their most recent tax filing available, but the income portion asks for their current monthly income. It wasn't clear to participants whether they should enter their current income or the income on their tax returns, and they were unable to find a tooltip to help resolve their questions. I'm going to skip over minimum essential coverage because this is a policy aspect. And then the second key theme that I'm going to look at is comprehending eligibility and next steps. So after submitting the application, participants were presented with confusing information about eligibility determination. They didn't know how to or really feel encouraged to proceed to enrollment. The result of this is they did not understand their eligibility. For those who qualified for Medi-Cal, there were no clear next steps. The reactions to this were confusion and discouragement. So we actually have a video here, and for those of you who are listening via phone, make sure that your computer speakers are on so that you can hear it. And I'm going to go ahead and play that. Okay, so you saw some of the participants talking for themselves about their reactions, and you could hear that they were kind of discouraged. They were frustrated or disappointed, and a lot of times they didn't even know what they really were eligible for. They tended to focus on the things that they weren't eligible for because those were displayed just as prominently. And there was really abundant and confusing jargon at this point. Terms like premium assistance and enhanced silver benefits weren't defined, and participants found that confusing. You heard one participant talking about how maybe the enhanced silver benefits, that's because of my age. And you also saw the those who qualified for Medi-Cal were particularly unsure how to proceed. The message, you must choose a Medi-Cal health plan by March 1st, 2004, we will choose one for you, was really a stopping point. There's no way to search for a plan or continue on the site. And they really just hoped that they'd be contacted soon. And you also saw, if you get conflicting eligibility results, that they both must choose a Medi-Cal plan and also not eligible for Medi-Cal. These participants really didn't know how to continue. The eligibility results page was slow to load for most participants, and the average wait time was over 4 minutes. About a third who reached this stage received either error messages or had to refresh at least once. But other than this page, technical errors weren't common on the site. Again, I'm going to skip over document submission requirements because it's a policy aspect. And that brings us to our third theme, which is entering simple data. When inputting personal information into the data field, participants usually knew the answer, but just had difficulty entering the information. The result of this was reduced efficiency, but the reactions to this added up to a lot of frustration, self-blame, both disrespect of the site and feeling disrespected by the site. We heard a lot of people talking about a desire for a smart form. Neil says, I don't see this as a smart system. It's as if somebody has picked up the paper form and just put it online. So some examples of this included entering the same information multiple times, being asked questions that weren't relevant for young children, or entering repeated information from multiple family members. We also saw people just really struggling trying to enter their information. The Social Security number was an example of this, where most people typically entered it initially with dashes, but there weren't enough room for these characters in the box. So then they'd delete it, start over, and enter it without dashes. And they'd click out and see it convert to a dashed format. This is one example of other ones like phone number, date of birth, where they really just got frustrated just trying to enter it the way the system wanted. Relationships was a difficult one for people. There was this long drop-down menu of alphabetically listed relationships, and they were looking for terms like mother or father, but finally found the term parent listed near the bottom. They also struggled to enter values, particularly entering their income. Most people would write their income something like $30,000 with a comma, but when they'd enter this, they'd get this error, please enter a valid amount. So they'd try other things, trying to guess what the system wanted, like adding a dollar sign, when what it was really looking for was entering the numbers without any comma. The fourth key theme is understanding steps and sequence. Participants had a limited understanding of the intended steps, and they weren't adequately guided through the process. The results of this were not understanding how to accomplish their goal of enrolling in a plan. Their actions were nervousness, fear of commitment, and feeling lost. We have another video here that I'm going to play. Okay, so you saw some participants reacting to this phase. One of the issues here is that there was really no clear path. Participants went to a large variety of first pages after the home page, whether the top navigation bar, the 4 yellow buttons in the middle navigation bar, or the Shop and Compare tool. And at the time that we tested, there were 3 different navigation structures on the site. There was the home page, the Shop and Compare, and the application. More than a third of participants who created an account had to be directed to select Apply Now to begin. And you saw users being really unclear what it meant to apply, especially after they had already mentally selected a plan from the Shop and Compare that they were happy with. You also saw a fear of commitment. Participants were nervous that they were committing to purchasing health insurance before they were ready. This was a lot about a lack of clear communication whether the next step in the process would involve payment. You saw that concern at creating the account, submitting the application, and enrolling in a plan. Participants were very unclear that Shop and Compare is a preview. They wanted to spend a lot of time selecting a plan at this stage. And it was unclear to participants that this was a preview of plans for which they might be eligible, and the ones that they would be eligible for at the end would likely be different than the ones that are available here. They thought of this as a step similar to online shopping. They'd pick a plan and purchase it. Medi-Cal eligibility at Shop and Compare really stopped those qualifiers. There was this grayed out button that said no options available, and it does provide a phone number to call, but it doesn't guide them to continuing with the application. So the 5th theme is finding information and answers. Participants often couldn't find the information they were looking for, and help within the site did not provide adequate assistance. The results of this were postponing applying, giving up, and the reactions were avoidance, frustration, and feeling abandoned. There's a lot of information on the site, but despite this, participants often didn't receive the answers to their questions. They were often reluctant to apply or enroll without these clear details. Some common questions were, what happens if I can't pay the premium? What are the penalties for canceling or changing my plan? What are the penalties for missing enrollment deadlines? What are the start, end, and billing dates? Do these plans cover dental? And what is Medi-Cal? Several thought a searchable database would have been helpful for finding these answers. There is help online, but participants really didn't find it particularly useful. One had over an hour wait for the online chat. Others tried filling in the form online, but they didn't quite know what to enter, especially in the case ID form. Those who qualified for Medi-Cal wanted basic information about the program. There was no program information or a link to learn more from the eligibility page. One participant looked around and found a fact sheet on the site, but it just told him for more information to visit Covered California. There was, at the time of testing, an FAQ, but no participants found it. But it had a broken link to DHCS. And the last section is comparing and choosing plans. We're going to look at both Shop and Compare and enrollment. Participants struggled to understand their plan options, compare multiple plans, and decide what plan was right for them. The result of this was really postponing the decision. The reactions were feeling overwhelmed, resistant to making a decision, and wary of commitment. So the design of Shop and Compare and enrollment were vastly different. Those who viewed both sections had to really learn 2 different systems and struggled to relate the plan results. We're going to look at Shop and Compare first. So in Shop and Compare, participants were giving a preliminary look at their assistance eligibility, but these options weren't explained. So it would say things like, you are not eligible for premium assistance. So those who didn't understand these terms were confused and felt excluded or discouraged. Some thought that premium assistance might be something like customer service. Nicole says, I don't know what premium assistance means. Does this mean they won't talk to me? Or in a line of 20 people, I'd be 21 and not 1? There's also insurance jargon. They really struggle to understand a number of the insurance terms, such as premium, deductible, copay. Raul says, I don't understand that mumbo-jumbo they're speaking. They're using Dr. Seuss language. And there's no definitions provided in Shop and Compare. And they really wanted to spend a lot of time selecting their plan. They believed this was the point where they were making that decision. One wanted to create a really detailed spreadsheet. Another wrote down the details of each plan. They were really spending a lot of their energy at this point. Then we're going to look at enrollment. they really had difficulty viewing multiple plans and plan details in enrollment. You could only see 3 plans at once, and you could access more by scrolling horizontally. The details were accessed by expanding vertical accordions below each plan. Susan says, I don't like this screen and a screen right here. It's just too difficult to navigate. It's too much scanning back and forth, and it needs to be more organized. And participants were often overwhelmed, particularly those in large cities. They would receive 28 plans, and they found this overwhelming. And only a couple found the options to sort or filter. So they wanted an easy way to compare plans. There is a favorites functionality, but only 2 people discovered this. Instead, they tried to add multiple plans to their cart to compare them. But the system only allows them to put one in the cart at a time, so they were frustrated by that. And so metal tiers are groups of coverage and price for different types of plans, but there's no explanation of this in the enrollment section. The only thing that was available were these icons, P, S, B, standing for bronze, silver, gold, platinum. And those who hadn't already learned about metal tiers, such as in Shop and Fair, had no idea what these letters meant. And the platinum and silver icons were the same color, and so that was confusing as to how they were different. So in conclusion, we really found that a combination of frustration with the site and the inability to find answers to questions prevented participants from feeling comfortable making a commitment like this. We recognize that making decisions about healthcare is a really difficult process. The site design can't eliminate some of these big questions about which plans are right for an individual, but we really believe that clear paths, helpful information, and simplified data entry can minimize the burden of this process.
Thank you so much. That was Allison Meyer of GoToMedia, and we appreciate the work that they've done on this project and their presentation. This is Marian Mulkey of CHCF. Let me just let everybody know that the slides and videos from this presentation are going to be available at chcf.org later today. And also that if you have questions, you can submit them through the WebEx chat, and we'll try to respond to as many as we can in our allotted time. I want to turn now to Deborah Backrack of Manat Health Solutions, who's going to offer some observations from a policy perspective on this research exercise.
Thank you, Marian. So, as Marian said, I want to walk through just a few examples of what we did using a policy lens. In other words, we asked, does this eligibility enrollment process comport with the letter and the spirit of the Affordable Care Act? And to be a little bit more specific about what I mean, we had 3 key requirements that were in the back of our mind as we watched what was going on and what Allison just walked you through. First, the requirement for a single, streamlined, and seamless application for Medicaid and tax credits. Second, was the applicant only asked for information that was necessary to determine eligibility for coverage? We know that's one of the key requirements of the good consumer experience that the ACA anticipates. And finally, the electronic data sources. Again, electronic data sources are to be used to the maximum extent possible to verify eligibility. Documentation an absolutely last resort after self-attestation and electronic data. So let me give you 3 examples of how this played out. I think all of them you saw on the screens just now. The first was the request for documentation of residency and incarceration. Now, on residency, and particularly with respect to state Medicaid, or in California's case, Medi-Cal program, federal rules allow states to stop with self-attestation of residency, and likewise for non-incarceration status. So the state could stop there. On the other hand, if a state goes further, the first place a state would go to is an electronic data source, and only if there was an inconsistency after checking an electronic data source or there was no electronic data source available would the state go to documentation. And as you saw in the video clip, the individual or the applicant was asked for documentation of both residency and his non-incarceration status, which, as Allison noted, made the individual feel disrespected, but it also brought this seamless and, simple application, making it not so seamless, not so simple, but raising the policy question, why documentation of these two eligibility criteria? The next one, again, you saw was a question. Now we move beyond documentation here to the question about citizenship. Individuals asked, are you a citizen? And answers, yes. And then the next question is, are you a naturalized citizen? Which, of course, was confusing to some of the applicants, but really more significantly from a policy point of view, probably shouldn't have been asked at all, because the basis of citizenship is not an eligibility factor. And the last point I want to call out is the Medi-Cal experience. And I think you saw this, that the site really did not consistently support a unified application experience for Medi-Cal eligible individuals. You know, on one hand, and I don't know if you saw this, the tagline says something to the effect that Covered California is the source for health insurance coverage, including Medi-Cal. But on the other hand, when you got into the site, getting information on Medi-Cal was difficult. At one point, one of the applicants did find something to click on, and it provided a history of Medi-Cal. And you saw the confusion about what is Medi-Cal and no easy way to get an answer. But again, from a policy perspective and looking for a single and seamless application process, when individuals got to the end of the process, they didn't know how to select a Medi-Cal health plan. They didn't know what to do. So again, not a unified application process. And for the individual who started through the shop and compare pathway, when they got to the end of that, they were told to call a number. And again, not a single and seamless application. So for the Medicaid eligible applicant, it was a less smooth experience, a less happy experience, if you will. So let me kick it back to you, Marion, with just those few highlights of some of our policy concerns.
Thank you so much. That was Deborah Backrack of Manat Health Solutions. A reminder that if you have questions, submit them. We're collecting some, and we'll offer them shortly. And now I want to turn to our reactors from the state. Let's start with Tien Lam of Covered California. Tien, we're so happy to have you with us, and look forward to your remarks.
Thank you, and good morning, everyone. And for some, conferencing in or webinaring in, it's probably your afternoon. Tien Lam, Director of Eligibility Enrollment with Covered California. And before I react, I just wanted to first off thank the California Healthcare Foundation and their team in going out there and doing some one-on-one interviews with consumers to really let us know areas of confusion, site navigation, and readability, and in particular issues where we really need to focus on. So again, wanted to thank the California Healthcare Foundation. Secondly, wanted to thank all of our stakeholders, everybody that's been involved in helping us think things through. We did our best, to be honest, with the amount of time that we've had, and really, while we did, in fact, enroll, at least in Covered California, nearly 1.4 million consumers, we absolutely have opportunities to improve the online application process to make it more seamless, to make it more consumer-friendly, and to be more consumer-centric, which definitely one of our core values at Covered California is being consumer-focused. Now, a couple of key things that I really wanted to point out and acknowledge that we know we need to make this better. A lot of the feedback about how words matter really will help us moving forward as we take a step back to talk about some of the lessons learned that we encountered during the open enrollment period. Some of the information that's is a resonating and a reoccurring theme, particularly when it comes to how we display and present information regarding national immigration status, U.S. citizenship, and things of that sort. Definitely an area where we need to focus on bringing the reading grade level down, but also ensuring that the navigation is much more seamless for consumers. One thing that I do wanted to call out that was very, very helpful in the report is while we knew that the navigation process was not perfect, it was really, really insightful to acknowledge and to see and to hear with by way of the videos how consumers, particularly with the Social Security number and the dashes, and then later displaying the dashes at the end result of once they've entered in everything in all numeric format, that those issues really are very, very burdensome. And so that's an area of opportunity in which we will definitely be focusing on as we find ways to further enhance the consumer journey. A lot of good feedback that we've received. Definitely one of our goals is to make it seamless, to make it self-serving, where consumers can do it basically on their own. And we realize and know that we have to provide consumers with more tools. The type of information that we provide to them and how they have questions to a particular question, we really do need to do a better job in helping them guide themselves through the process where they have a clear understanding of what this question means and how that information is used to determine their eligibility. And so I don't want to, I can go on, but I don't want to take up all of the time because I know our partners over at Department of Health Care Services, Ms. Dotson is on the line as well, but we really need to do some additional work, and we appreciate that everybody has been out there to tell us feedback from the community level, and definitely this information will be used to help us further refine, further improve, and make it a much more consumer experience. And hopefully, by the next open enrollment period, it won't be perfect again, but it will be better, and it gives us an opportunity to even enroll more consumers into Covered California subsidy and non-subsidy as well as Medi-Cal. So with that, that's my reaction, and I know that there's going to be Q&As, and I wanted to see if Anastasia would like to include her remarks.
Thank you, Tien. Yes, we're going to turn to Anastasia Dotson now. Let me say for participants, we don't have more slides. People have been asking. The slide section is done. Those will be posted later. And Anastasia Dotson of the Department of Health Care Services, can you offer your feedback, please?
Well, thanks so much. Yes, and thanks to the Foundation for supporting this project and for our wonderful partnership with Covered California, with the counties, with the agents, with all the CECs, everyone. It's really been quite a project, quite an effort over the last few months to get the system up and going and to have such a wonderful response, so many people enrolling. It's challenging, as you all know, to get so many people enrolled in such a short time, but we're overall really excited to have so many more people getting health coverage. So we want to just, acknowledge that part of where we are as well. And in general, yes, we agree that we need to keep doing more work to refine the application, the questions, and we've actually got our stakeholder process, our AB 1296 process underway where we're getting ongoing feedback. We're in the process of collecting all of the potential changes to the single streamline app and looking through to prioritize what we can do now and what's most critical for addressing the concerns that were identified here as well as other areas. The overall picture, though, I really think it's important to think about how what the system is designed to do is several different things, and so in some ways it's a balance in trying to achieve all of the purposes for which it's intended. It's a consumer portal, it's a rules engine, it does several other things that are important to both Covered California and DHCS Medi-Cal. So, as we continue to make these refinements, we have to look about how we balance all of those priorities and functions, and in fact, they're all interrelated. And so, but we agree, and we know that the best way to continue to make refinements is to have an ongoing communication process with users of the system, people who are applying through the portal, consumers, as well as all of the other users of the system, the customer service reps in covered California, the counties, the agents, the CECs, so that we're getting the complete picture when thinking about how to prioritize and move forward with changes. So I'd say that's it as far as comments from DHCS, but would look forward to any questions that we can answer on this as well.
Thank you so much, Anastasia. So we have been getting quite a number of questions, and I'm going to start with one that's really a foundational one about the study itself. So there are questions about how, and I'm directing this to Allison Meyer of GoToMedia, there were questions about how consumers were recruited, whether we observed differences among demographic groups, and really, you know, the basis for our confidence that this set of consumers is reflective of the experience that we were trying to observe.
So by a combination of online postings and other postings, we did multiple levels of screening to try to understand. We were looking who they were and what their situation might be. We were trying to find participants who had a wide variety of situations, income, household size, as well as just a variety of backgrounds. We looked for people with a variety of technological, educational background, age, ethnicity. We were looking really for a range to try to get the best responses possible.
Great. Thank you, Allison. So another question, which I'm going to address to Tien and Anastasia, comes from a participant who asked, to what extent were some of these findings anticipated, and were there any surprises to either of you in terms of what came out of this study? And maybe, Tien, you might start. Tien, have you muted yourself?
Sure. Can you hear me okay?
Now we're good. Thank you.
Oh, okay. Thank you. Sorry, I didn't mean to scream into the phone, but I thought I was not loud enough. So this study, a couple of key points that are I can quickly think of as it's very rich in its content. The information that we knew was a problem that we heard by way of our Covered California Service Center and feedback that we received through all of our service channels, such as certified enrollment counselors, agents, were particularly the eligibility results page. It was confusing. Stakeholders also provided feedback that we're promoting too much of what consumers don't qualify for versus what they actually do qualify for. So that was something that we learned through the open enrollment process. Areas in which I thought was extremely enlightening is the plan selection process, particularly the shop and compare tool versus the actual plan selection process and the metal tiering and the confusion. We did learn a little bit later on in open enrollment that enhanced silver plan really doesn't mean anything to people, and that it's extremely confusing. And so we definitely need to focus on ways in which we can better present the full array of plan selections and plan products to consumers. Another interesting item that was through this report that we've not heard by way of any of our service channel were particularly the data entry process, the dashes, like I noted earlier about the Social Security number, and in certain reports, how you enter in income, that, the dollar value is required. So a lot of good takeaways.
Yes, and this is Anastasia. I think some of the sort of overall issues, I think we were to a certain extent aware of. As the question about surprises, I think what we did find a little bit surprising, as Tien said, and some of the language nuances around silver, et cetera. But again, sort of what we do know is that there are key points where we need to do a better job of explaining how the process works for Medi-Cal, and but again, we sort of have to balance that with all of the other competing priorities for the system right now.
So thanks to you both. I think that for us at CHDF as an observer of this work, it was really eye-opening to put yourself in the seat of the consumer and have, as they wrestled through some of these questions that maybe seem straightforward to those of us who've been working on these issues for a long time, but questions of household composition or income level really were challenging. So, that bird's eye view was helpful. I want to raise one more question, and we may have time for even another after that. But a question that's come up in a couple of forums from participants is, where really are we now as the initial open enrollment period has closed? What can you say about the performance of Covered California, the portal for people who might be in that special enrollment period and be using it now? And then on the Medi-Cal side, what can we say about people whose status maybe is still to be fully resolved in terms of their eligibility and enrollment in the program? And we know that along with the extraordinarily large number of people who have enrolled, there are also a very large number of people who are still getting that final loop closed. So I wonder, in terms of the special enrollment period, Tian, if you might address that, and then Anastasia maybe in terms of closing the loop with people who were thought likely eligible on your side.
Oh, okay. I hope folks can hear me, and if not, I'm sure somebody will say unmute yourself. So during the open enrollment period, particularly in the months of December and then going into late February and March, the system was in fact not performing in its ideal capacity. We know that loading pages took a long time. We actually received quite a few calls at the service center, whether it was a consumer, certified agent, or certified enrollment counselor who basically said, what is going on? Why is it taking so long? We can't navigate to the next page. Is this a problem with our computer or what's occurring? And it really was a CalHER's online performance issue with Covered California. During that time frame, we did a lot of analysis, a lot of performance monitoring, identify areas in which we could further improve the system performance. Still a learning process as we go back and have an opportunity to revisit some of the key issues. But with regards to the special enrollment, we are receiving less reports about the performance issue during the special enrollment period. For probably a couple of things, some of the improvements that we've made from a consumer, certified enrollment counselor, certified agent perspective has improved from our lessons learned and implementing some best practices from a technical standpoint. But also, the volume of consumers applying during the special enrollment period has, at least for Covered California, has decreased in comparison during the open enrollment, particularly in the months of December, February, and March, and actually even into early April. But we do have to, while we've identified issues, we have to absolutely prepare ourselves for the next open enrollment period, which will include new enrollees coming to the door and trying to apply for coverage, as well as renewing and retaining our current enrollment, where system performance is going to be very, very critical to ensure that consumers do not get frustrated and don't renew or don't apply for coverage.
Thanks, Tian. And Anastasia, on the Medi-Cal side, sort of these coming months, what should we be looking for, and what can we know about the remaining resolution of folks likely eligible?
Yes, so we've been watching and monitoring and taking action steps pretty much daily over at the HCS and in conjunction with the CalHER system and county partners and SAWS partners. So basically we know that there are, it's a very, very significant, serious issue right now, and we're looking at all available options. We're also looking at ways that we can better communicate with consumers about what's going on. But there are many things happening sort of all at the same time for different types of consumers for different reasons. So again, we know that there's core eligibility functions that are happening, and it is going okay for some consumers, and so we don't want to say one thing or another about everyone. So those things that need to be addressed for example, for consumers that need to get moved over to APTC, we have a strategy for those consumers. For consumers that have people may have miskeyed their date of birth, their Social Security number, those types of things. There's a set of action items that we have for those types of cases. There may be some issues related to for folks that have not yet provided verification of their income, and so we have action steps for those consumers. So we have a variety of steps that we're taking in partnership with everyone, and so we know that needs to be the highest priority right now, is to get folks' eligibility resolved. And then at the same time, we want to make sure, again, that we're keeping our eye on the ball on the future to plan for the renewals, the pre-populated renewal forms that we'll be using next year, and the single streamline app changes that are important to make sure that we get people's eligibility as quickly and cleanly as we can. And as you said in the beginning, using automated sources and asking us only those questions that are necessary to determine eligibility. But of course, thinking as well about if we do ask more certain types of questions, then from a consumer web portal, we actually can find a way to get a better match on some of the data sources. So there's a balance there.
Thanks, Anastasia. That's quite helpful. So the final question that I'm going to raise, it came in one form, but I'm going to ask it, I think, kind of in a variation on that, which relates to the fact that this research was indeed conducted in English only with English speakers, and generally speaking, people with a reasonable amount of education as well. The question was, what about Spanish? Why didn't we do the research in Spanish? And I'm going to broaden the question to really what are the opportunities, what are the similarities maybe and the differences between native English speakers and people who might be trying to approach this process either entirely monolingual in another language or with much greater capacity in another language. And so I think, to a certain extent, the reason that the research was conducted only in English was a pragmatic one, that in terms of the time that we had and the resources that we had, we needed to do that. And the site, while many parts of it are available in Spanish, I think that the notion of doing this well in English was a big enough lift from the CHCF resource perspective. But let me ask, clearly this has been a priority all along, and I'm sure it remains a priority for Covered California and DHCS. Is there anything that you'd like to add in terms of your efforts to address non-native English speakers, or that you'd encourage, research entities like us to pursue potentially in another round?
Anastasia, I'll kick it off.
Do you want to start, or?
Tian, sorry. Tian, go ahead.
Go ahead, Anastasia. Oh, okay. So absolutely. So for an example, with our paper application, I always like to go to our paper single streamline application. That was actually one of the, I have to say, most, it was a very great experience, because for our paper application, what we did was we focus grouped English, Spanish, Chinese, Vietnamese, mixed ethnicities in northern Sacramento and southern Cal. And we strongly believe, at least from a paper application perspective, that we did roll out a product that was very consumer-friendly with a lot of great frequently asked questions. Clearly, with the no wrong door approach, our best practices with the paper application needs to also be modeled by our online process, where we will be exploring opportunities, and we absolutely have received a lot of feedback, particularly on our Spanish website, that it's not culturally, linguistically appropriate with certain words that have been translated, although we did our best. And while we have made some refinements to the Spanish website, we would look forward from not just a words matter, but from a navigation perspective, to have opportunities to be able to test the online application targeting our Spanish-speaking, Spanish-reading community, because clearly if the application is available online in Spanish, we also need to do some focus group testing or one-on-one interviews there as well. And with that, I'll turn to
Thank you, Jen. Well, we are already very, very near the end of our time, so I'm going to go ahead and tie it up. I really want to thank all our speakers and appreciate that we had many people participating, and I hope most of them had a good quality experience, but I know that there were a couple of issues with sound, and I apologize for that. I want to just very quickly summarize. Clearly, California has a lot to be proud of in terms of its impressive early enrollment numbers and its continued commitment to taking full advantage of ACA coverage expansions. At the same time, I think the GoToMedia analysis really documents that there are a number of areas that warrant continued attention. Consumers struggle to understand questions and accurately enter data, and they often leave the process confused about pretty basic concepts and the bigger picture. Addressing user experience issues to make it clearer and easier for consumers to accurately answer questions would not only help consumers feel more confident and satisfied, it would also smooth the path for re-enrollment next year and make it more likely that consumers actually end up enrolled in products that serve their needs well. So we absolutely applaud Covered California and DHCS for the enormous work that they have put into bringing us to this point in implementation in California, and we also encourage them to continue to identify and implement improvements as they have graciously indicated they intend to do today. So I want to say thank you to our speakers, Allison Meyer, Deborah Backrack, Ken Lam, and Anastasia Dodson, and to all our participants. Slides and video, including a couple of video clips you did not see today. There are actually 4 in all that were produced from this project, will be available at chcf.org later today. I'm Marian Mulkey of the California Healthcare Foundation, and that concludes our webinar.